Thank you so much, Dr. Edmund, for that powerful presentation. I, as a layman, as I think I have learned a lot, and medical people, I mean, in the platform here, I believe that they have understood better than I. So I will give the opportunity to our audience to either ask questions or give their contributions to this topic.
My first question to you would be, vaccines work, as you explained, in the sense that you introduce a kind of a disease attenuated, that is kind of safe level, that will not actually cause the disease, that will build the immune system. Still in that kind of analogy, if somebody is already infected with a rare disease, it is believed that, or the mechanism is such a way that the person is recovered, or the person recover from the illness. That person must have developed the immune system, those memory cells, in such a way that the secondary infection, the person will have the immune system to fight the second infection. We have seen some result or some report. I don't know how credible they are, that there were some patients, or there are some patients out there that contacted COVID-19. They were treated, they now have second infection, or they are now being infected. If you relate this to vaccine, it would therefore means that we are not very, I don't want to say we're not very sure about the vaccine. So how would the vaccine really be effective if somebody is really infected with a disease and has recovered from it and reinfected again? Then how much of, if you introduce a vaccine, that will take time to even develop the immune system?
So, Ernest, thank you. This is why I wanted to just dwell on the process and then answer your questions rather than try to talk. And I remember I just talked about vaccines generally. I didn't focus on COVID as a particular disease, but by nature, viruses mutate. And there are some of those viruses that will mutate in a way that each passing year, a different strain comes up. COVID is like the cousin of the flu, and they are the same coronaviruses. And if it's going to behave like the flu, then every year we're going to have a different vaccine for COVID. And so the idea that some people got infected and got again reinfected, we don't yet know that that is clearly true, but there have been reported cases. But let's say that there is. It's actually asking us one of the questions, or maybe like posing one of the questions that we cannot yet answer with COVID. Like, if people develop antibodies against the disease, how long do those antibodies last? And at what level of antibodies does somebody become again susceptible to the infection? And has COVID mutated? Has the virus mutated to a point where there's a different strain that can reinfect somebody who has already been infected with the first strain? So these are questions that are still quite yet to be answered. But in the case of vaccines, there are some disease that if you already got it, then you don't really need a vaccine for it, because your body would have developed immunity to it. And one of them is like the hepatitis. So when you come, they test you, they test you, and then they will say, do you really have antibodies? Those protective antibodies against your system that is telling the story that you already developed the defenses against that disease. If we have that data, then we don't need to give you a vaccine. But again, with coronavirus, I think coronavirus, if it's going to behave like the flu, you realize that if you're here in the United Nations or in the Western world, that you need to take the vaccine, the vaccine every year, because it doesn't behave like the hepatitis B virus, for instance. Because each year there's a different strain, and therefore we actually have to have a different modified vaccine to attack that strain. So COVID is probably going to be that way, and the other thing with the COVID vaccine is we don't even know. You may require more than one dose of the vaccine. You may require a dose and then do a booster, like they do with again with Hep B and then with the human papilloma virus. So again, it's going to depend on some of these studies on the antibody levels and how are people reinfected, and is it mutating, and what are the different strains and stuff like that, which are still being studied. So my focus was to really focus more on the general topic of vaccines, because one of the things that I'm worried about, and you can see it in America, measles were long gone in America. And after that is because the vaccination rate in America was around 98%, 95, 98%. But more recently, because of this anti-vaccine skeptic campaign, that level has dropped down to probably somewhere like 90%. And we start beginning to see measles again rear its ugly head. The same thing may happen in Africa with polio and stuff like that. Remember that when you eliminate these viruses, they don't just completely vanish from the face of the earth. They are somewhere. You stop the vaccine, you stop the immunization, and we reduce our herd immunity. These things can come back. Viruses are not living things. They are just there. And they need to enter your body and then co-opt your body's machinery in order to develop. And they were here before us, and then they will be here long after the human race is gone. So we need to respect them.
Thank you so much, Doctor. Any other contribution or question, please? Dr. Nkembele, is he with us?
A lot of people talk about this out there. First of all, there's a school of thought that says that vaccines cause autism, and they don't want their children to have vaccines. And that is a myth. So I just want to make sure that people know that. And that actually came from a long study that was around 1980 and 1997, which has still been proven to be false. So that is a myth. Also, it's important for us to be able to follow the vaccination schedule in our children and those who are here in the diaspora in the United States and those back home. I think we have a very, very important vaccination program. And as you have rightly said, things like measles, mumps, all this has been eradicated thanks to the aggressive vaccination program. Now, I want you to address this. As you know, sometime this year, there were two French scientists. I think one was, it should be Jean-Paul Mira. He was intensivist in one of the hospitals in France. And they were talking of trying a tuberculosis vaccine in people in Africa to see if it can work against coronavirus, something like that. So, and this has brought a lot of fear to people in Africa. And if we're talking this to somebody who had this information and the person is living in Chico and you are telling the person that please go and take your vaccine, what else would you want to add to your message if this person had this message before? Thank you.
Yeah, and just before I address that question, I thank you for raising that autism issue, which first appeared in the Lancet, as you rightly said. I think it was 1997 or so. And it turns out that, and that's actually one of the things that you have to realize with science, that there are also, people in science who place their career above above truth, and that is quite unfortunate. And people would want to cut corners and come up with all these type of terrible things. And sometimes with journals like Lancet, which is actually one of the gold standard of medical journals, even those people, even the editors of those highly regarded journals can sometimes be fooled. But eventually it takes time. After that autism study came out, a lot of people couldn't replicate that. And that has been debunked over and over and over and over again. Vaccine don't cause autism, period. And that's been debunked, and that they've actually forced that guy to retract that study. They just simply cooked up the data. So coming back to the point that Kembele mentioned, it's really unfortunate. Again, I don't know whether those French scientists, whether it was an inartful statement or it was really deliberate. Because one way you can look at it is to say, where they're saying that, which I would support, if you want to take, if you want to do trials like COVID, for instance, and don't do the trials on white people and then tell me that it's going to work for everybody, because there may be differences. Don't do trials in Black people in America and tell me that it's going to work for Black people in Africa, because there may be environmental differences and some exposures that may make the vaccine work for us here, but not for our people back in Africa. So there is a need to really test the vaccine too in Africa, test the vaccine in South America, test the vaccine in China, test the vaccine in Europe. So everywhere where you want and where you need to use this vaccine, those people may be tested. As a matter of fact, this is one of the cardinal things that we as clinical trialists face and must really take into consideration when we're enrolling patients in clinical trials, which is to say that the people that you're eventually going to recommend that particular whatever you are testing for must be adequately represented in the sample that is taking part in that study. The question that we need to be asking is, are we actually ensuring or applying the same rigors of safety amongst our people in Africa, or for every less affluent societies than like that we're doing? Are we applying that the same safety guidelines and standards in among those people like we're applying in the part of the world with the more affluent or quote unquote developed world? So that should be it. And I would just end up by saying that by the time most vaccines get to Africa, the things like I talked about, the phase 1 studies, for instance, that's not really something that you can do in many African countries. Probably you can do it in South America, in South Africa. That's probably about it, because the expertise, the resources, that are needed to really go through, conduct those studies, these are not things that our own hospitals can actually be able to provide, or maybe our own that we have. So, and even here in the United States, only a very small select group of hospitals or centers actually are equipped to do those phase 1 studies. And the experts that can do them are very few. So by the time vaccines get to Africa, they're almost usually around phase 2, phase 3. And so I think I'm going to tell the person in Tico that when this COVID vaccine is available and it gets to Cameroon, my mother would be the first person on the line the day that it gets to her, and I will say, go get yours. Because here in America, I'll be the first on the line to say I'm going to get it. Again, because I know how safe these things are. And it would be, but we need to condemn people like those scientists in Paris if the statement they were making was actually saying they should prey on Africans to use Africa as a way of collecting data without the same safety measures, which personally I probably don't think that that's what they were saying. But in a world where people treat us Africans like we were some humanoids, or maybe some intermediary between ape and humans, you sometimes cannot really see why. You can sometimes see why people become very skeptical. And I think the French government itself, this is one area where I agree with them, because they came out, and then the French, even their own system, came out and condemned those and say, sometimes you're doing this, realize the damage that you may cause with some of these very inartful messages that you may send out. So I hope that is clear. And again, these vaccines are safe, but let's remember that there will be unscrupulous people everywhere. What we should be asking is, are we making sure that they follow the same safety guidelines? And when they get to us, let's also one thing that we need to make our governments really be keep our governments on their toes is to make sure that the vaccines are kept in the right conditions and administer in the right conditions. Because you could have a very safe vaccine, you could have a very effective vaccine, and then by the time you send it there, and if it was supposed to be stored at 4 degrees, and then they go and store it at 30 degrees, it destroys the whole thing. Or maybe they get it contaminated, it destroys it. So it is no longer the problem of the virus, or you leave it somewhere where bacteria will grow in it. People are dying. It is no longer the problem of the vaccine not being safe. It is the method in which it was stored. It is how it was given and stuff like that. or you send out to somebody out there who is not well trained, and instead of giving this much of a dose, that person now say, oh, let's rationalize, let's ration it. Or, you know, so there will be so many things, you know, the process. That's, to me, worries me more in Africa about how, you know, when it comes to the eventual effect of the virus itself, it's actually the implementation of the protocol itself that worries me more. Thank you.
So you really point out on something that the question that I already wrote down about the logistic of when transporting vaccine, because especially back in our villages or in our remote area, where, because for me, I know most of these vaccines are stored under very strict temperature, usually in the refrigerator. Then we in Africa, especially around the equatorial region, has very high temperature. So sometimes I begin to wonder the means which some of these vaccines are actually stored, method of delivering, of administering vaccine. You talk about maybe contamination. What do you really think? And also the credible source, with all this information coming from left and right, people would shoot video that was for a different purpose, then insert it and begin to make some propagation about vaccine. What can you really say to our people in such a way that I will know that yes, this is a credible source of vaccine coming in? These are credible people that are coming to vaccinate children. These are real. I shouldn't be scared or anything of that kind.
I think let me start back on the first question you asked about the logistics. Yeah, as you may be aware, that, I mean, the temperature control requires light, right, to run fridges and stuff like that and so on. So there've been some people have been thinking. One of the things that excite me in this country is actually people thinking about problems, including problems of the developing world, and trying to solve them. I mean, there are people already now thinking about, you know, building these tiny little delivery mechanisms with equipped with solar panels that allow for the light to, you know, for electricity to generate and keep the vaccine in the adequate, in the right condition. In the past, they were like, you will see the vaccines, the people who carry this vaccine stuff with some containers that would like contain, yeah, some whether you know, some kind of icy condition or cold, you know, condition, temperature controlled conditions. So right now, people are beginning to look more at those solar panel delivery systems. Places like Rwanda, for instance, that are more far advanced like ours, are using drones to deliver many of these things already. So they get them and then they get them there really on time and so on. So I think that's an area where all of us, my hope is that once this thing comes through, that all of us, our country gets into a point where we can all contribute some resources into those places where it can help our people, some non-governmental organization, you know, make conditions available. I mean, you know, that they keep the right conditions and employ the right people who can go outside and deliver these vaccines to complement whatever WHO or whatever the government may be able to do. Remember that in this country, for instance, or the world over, some of these things that we're talking about, without people like Bill Gates and so on, who have donated their resources and continue to be, on the contrary, being maligned by people, those vaccines will not even get to us because of the prices, because the drug companies will not give them free. So these people, they are people who have to pay for them. So in terms of actually advocating, one of the things that we would all have to do would be the advocacy. Get to our people to let them know. There is an echo behind. So to be able to get to our people to know that, again, as we are talking about, that vaccines are safe. I expect all of you here to be an ambassador, to go back now and talk about this. And if we can organize bigger groups where some of us who are actually directly involved in some of these things, clinical trials and stuff, or who are in healthcare here in America and seeing what we are seeing. And many of you can go and learn these things as well, just like, so you can become advocates. We have a lot of patients advocates who are not healthcare professionals. They just get interest in learning about what are the challenges that healthcare, patients have, and including things like this. You can go back and learn this and put your voice out there. Many of us may not be able to do it all by ourselves. And unfortunately, the social media is like a double-edged sword, right? There is the good part of it. You can use it to reach many people like me and you are doing now. But you can also use it for a lot of destructions like the other people are doing. So how do we, conundrum, but it's one that we must figure out a way to solve. And one of the things is just be getting involved, be active, and shoot down when you see in any social media where you are, when you see these people who are coming up with all this nonsense, shoot it down. They are the reason why I get so upset about this is really, again, because they are killing people. Because for those people who don't get vaccinated, they are going to die. If you are here in America, America is 4% of the world's population. America has about 30% of the world's capital here in this country. Yet, America has 25% of COVID deaths. It is not because the COVID virus in America is more virulent. It is just because of the stupidity and that the COVID virus here was handled and continues to be handled. And so if we don't take time, even when the medications, if the vaccine is there, our people will continue to die if it is badly handled. So all of us, please see yourself as advocates, as social advocates, and get into the arena. When you feel, if there are, why do you think I spend my time to come to you guys when even if you call me back tomorrow, I'm going to come, because we need to put this message out. We need to save our people, please. I don't know how much more I can say this, but there is not a silver bullet to this. But I would depend on all of you to be able to do this, and I'll depend on your voices.
Thank you so much, Doctor. The floor is still open for more questions or contributions.
Yeah, Gillette.
Okay, yes, production engineer.
Yeah, thank you very much, Gillette, for the opportunity. I want to specifically thank Dr. Edmund for honoring this special invitation to talk about this vaccine. This topic is a topic which is floating around with a lot of misinformation. And with your presence here, it has actually cleared out a lot of doubts that I have. I had a couple of questions in mind, but listening to you speak, it has cleared it out from my mind. It is important that people get this message. The most important is for people to have confidence that this vaccine is going to be safe. And in my own, my question to you directly as a person, if this vaccine comes around, how can you as an individual ascertain that it is safe for me to take it? Irrespective of how, you don't know how it has been stored. You don't know how it has been handled. Is there a way for you as an individual to ascertain that this is safe, I will take it?
Yeah, Julius, thank you very much for that question. The COVID vaccine specifically, there are still some gaps. If you look at the studies that are done so far on the candidates vaccines that are most advanced, there are a few groups of people, three categories of people that are not included in that clinical trial. And that's where the really headache is going to be. This includes children. And that's because children are in a very, very special category of all clinical trials that we run. We need, first of all, to be able to show safety in adults and stuff like that. Then before you can actually start thinking about kids and designing things that you will need to, because, so they are the ones that I get a little bit, I'm not yet sure, but luckily they are not as seriously impacted by the COVID as adults, so that if once the vaccine that is currently in clinical trial is shown to be effective, then I think the trials for kids would eventually start. The second group are the people who have problems with their immune system. If you have a low immune system, then we are giving you something, we're giving you something that may not cause a disease in somebody with a competent immune system. That may be trouble, that may spare trouble for you. So those people are not, they were not part of the clinical trials as far as the best of my knowledge. But again, those are people that would eventually be included, will eventually study and see how that's really, whether that has a problem with them. I mean, that whether there is an issue, specific issues that need to be, safety concerns that need to be addressed with them. And the question you asked me, for you as an individual, you may not know, because we need to trust the system, right? This is why it becomes very, very important that everybody, from the doctors, from the scientists who do this, follow those clinical, good laboratory practice guidelines that I talked about, to the clinicians who test the researchers, follow those good clinical practice guidelines, to the scientists, the statistician, they design these studies. They have to calculate and make sure that the right number of patients are actually included in the study. And the regulators need to make sure that nobody is cutting corners. And then the politicians need to stay away from science and let the scientists do what scientists do best. And the regulatory bodies must make sure that anybody who cuts these corners, who cut corners on this, needs to be punished severely, so that this is the only way we can get trust back to the system. This is something that we all have to, it's almost like when you go to buy a car, right? You buy a car, and there will be some cars that would eventually be recalled because there was a problem with them. But when you go to buy an individual car, you just depend on the fact that the system must have tested and made sure that those cars are safe. And you don't go and with your own engineer or with your own mechanic to try and see whether a specific car that you're buying is safe or not safe, especially if you're buying it new. You depend on the trust. This is why trust in the system becomes critically important.
Ima, are you still there?
Yes, Gillette, I'm here. Now that you've called me, let me just use the opportunity to thank Dr. Edmund for the very elaborate presentation, and for clearing a lot of doubts in the minds of myself and I think many people. Because to be honest, I had so many questions based on social media information that I had gotten. And I had discussions with my husband and arguments because my husband is in the scientific field, and I had so many discussions, and I told him, I don't think I will ever allow our kids to take these vaccines because I'm not sure how safe they are for them, based on the information that is on social media and based on the misconception, I would say, that has been spread out, on social media. But listening to you this evening, and listening to the questions that you've answered so far, I think some of the doubts are cleared off. I won't say they are cleared off 100%, but I think gradually they will all fade off. And I just want to use this opportunity to thank you so much for dedicating this time to give this presentation, which is really, really vital at this time for a lot of people. And also just the fact that you encourage us to transfer this information to our parents back home, to families back home, because at the end of the day, they need the vaccine to stay alive, and we also need the vaccine to give to our children who are growing up, and why not us? So thank you so much, and thank you for the information, and for the opportunity to speak.
Thank you so much, Ima. Thank you, Ima. The opportunity is still open for those who have questions or contributions to give.
Most of you here are parents, and there is a specific vaccine that, you know, I don't know whether it may not be on the on the on the recommended vaccines, or maybe the common vaccines that are actually given in Africa, but nonetheless, so important, especially for the girl child. And I have daughters, so this is why this become critically important to me. One of the key cancers, one of the most common cancers in Africa is called cervical cancer. And it turns out that cervical cancer is actually caused by a virus. It's called human papilloma virus. And the vaccines that are out there now to vaccinate against those viruses, and those viruses are actually mostly sexually transmitted. So the vaccines that are there now that are actually recommended for young girls, these vaccines are probably 90-something% safe, you know, are preventing cancers. And this is unheard of. And I really encourage you people to really go back. Also, parents who have kids, the younger the kids, probably around the age of 10, 11, 12, the better. Because by then, they probably are not yet exposed to, you know, the COVID, I mean, the human papilloma virus. And they need to build those antibodies. And by the time they start getting sexually exposed at some point later on in their life, they have the virus, the antibody in their systems. These are immensely important, as you parents are talking about, even though we're talking about COVID now. Think about those vaccines as well for your, if you're here in the United States, I think when you take your children to school, I mean, to vaccinate, if you have a good pediatrician, they'll already be, you know, letting you know about this. So, but for home, I'm not sure whether they're available at home, but if they are, please get it. Let them get it.
Thank you so much, Doctor. I believe everyone is listening to it, and we are going to grab that opportunity to do just so. If anyone...
Sorry, if I may use this opportunity, I also have a daughter, so this is really important for me.
Yeah.
May you just give the name of the vaccine, please, because this is information that is coming. Really, I'm hearing this for the first time, and so sometimes you want to protect your girl child as much as possible, you know. So if we can have the name of this vaccine, maybe my next visit to the pediatrician could be a point of discussion if it's available in Europe.
Yeah. I don't know the name that would be that you have in Europe, but here, if you get there, here we would have, there are different strains of the human papilloma virus, many of them. So there is one that actually takes 9 strain that contains all the 9 that prevent against the 9th strain of the vaccine, that is called Gardasil, which is spelled GARDASIL. So there is that is actually probably the best one that because it also protect against genital warts, and some we're now also beginning to learn that some of the cancers of the head and neck eventually later on in life are actually caused by that vaccine. So that's actually the more advanced form of that vaccine. So if you go back to your pediatrician, to your child's pediatrician, and they're going to tell you, even if they don't have it there, they will tell you the equivalent in out there in Europe.
Okay, thank you very much.
Thank you very much, Doctor. Ladislas, any contribution to make?
A network issue, because he has not connected his...
Doctor, is it possible that one can take a vaccine and still be infected by the disease that the person has been vaccinated against?
The simple answer is yes. No vaccine is 100% effective. But many of them, like some of the measles vaccine was almost like 90-something% effective. And there is a concept that I didn't introduce as we talked. There's a concept called herd immunity. And remember that from the get-go, I said viruses especially, they won't grow if the outside of the body. In fact, we don't even call them living entities. They get into your body with just the genetic code, and then they overtake the machinery of your body and instruct your body to start replicating more of them. And so what that means is that for a virus to survive, what it then does is that if it affects me, by the time my body gets rid of it, it needs to find somebody else to infect and then start hopping from one person to the other. So if you have enough people in a community who are protected against the virus, who have developed antibodies to that virus, then what then happens is that that virus has nowhere to go, so it dies off. So this is exactly what the concept of herd immunity. And in many diseases, that concept of herd immunity, it depends on the number of people, right? How many people, the number of people who need to be infected in order to provide that herd immunity depends on the virus. And so for many of the viruses, I mean, even if the vaccine is not 100% effective, but more people get the vaccine to a point where the community gets to that herd immunity, then everybody gets protected. You see what I mean? So yes, so there are different layers. The answer to your question is yes, we see that here in America, where people would get vaccinated for the flu and yet may have the flu. But sometimes the flu is much less severe than it would otherwise have been if you didn't get vaccinated. For some people, it just doesn't work because it's not 100%. But every passing year, with all vaccines, you improve. But the hope again is that for some diseases, unfortunately, for diseases that mutate as frequently as the coronavirus or as the flu, it is almost impossible to develop that herd immunity. So there are things there that if you get the virus, if you get the vaccine, especially as we need COVID, there is still a lot that we don't know. This disease has just been around with us for the past probably about close to a year now. And for the other diseases that we've developed vaccines for, and this is going to be the fastest of the human vaccines that ever was developed, because most vaccines will take about 7 years, but this particular vaccine is taking less than a year. This is unheard of. And the reason why, and that was one of the other confusion, I should just use this to actually address that, because people were like, are they cutting corners? No, the reason why it took that long for most vaccines to be developed was exactly because to actually even define the genetic code of the virus took so long to even study it and understand it. But with computers, and every company was working individually and hiding the information they had. So now with this, because of the nature of the COVID, everywhere, everybody is collaborating and opening up the information they have.
My name is Sylvester. Can I ask a question?
Yes, okay.
Sylvester Aminkentaku.
Okay, Sylvester, you have the microphone.
Thank you, Dr. Edmund. I should have come late when you must have done the bulk of the presentation, and I probably mixed out in one thing or the other. So my question is, if you actually choose not to take a vaccine and you socially distance yourself, wash your hands, and wear masks, what is your take? Because I heard you say in the previous year, it used to take like 5 or 6 years before you could come out with a vaccine. So somebody was still very skeptical about vaccine, and you choose to like effectively wear your mask, because I know that masks can help spread this disease for about 80%, but you choose to wear a mask. What is your take about that?
If you chose to wear a mask, do social distancing and hand washing and stuff like that, and if you don't work in a system that they force you to take it, and that's your choice, yeah, that is okay if you want to wait. But if you ask me, I would say, again, if the vaccine comes and you were asking me if I were your physician, I would encourage you to go take that vaccine. But if that's the decision that you chose, that is really still, and you want to be, because I also want to be very careful that we don't appear like we're being too pushy. you know, for people to get what it may take them time. Like, I think, was it Immaculate or Mary talked about the fact that it's even though the doubts may not be 100% clear, cleared now, that they may eventually, you know, get, you know, you may eventually get those doubts cleared in your mind. If it's going to take you time to walk that walk, please do so. But I'm happy that you're talking about the social distancing and wearing your mask, which probably if we were all doing it now, it would just be as effective as some of the vaccines. But the problem is that it would just not, each time you let down your guards and not wear the mask, then we would be in the same spot, and then we will not be able to do all the things that we need to do. But with immunization, if enough of us get immunized, then it allows us to get back to life as normal if it is effective, right? Because then you don't need the mask again. Then you can go back to probably attending your friends and kids' birthday party and things like that, that some of us have not been able to do now. So, yeah, I hope that answers your question.
Yeah, thank you very much.
Yeah.
Thank you so much, Doctor. Any other contribution, please, or questions?
I think we have almost exhausted most of the time. Doctor, thank you for coming. If there are no more questions, please, we may likely want to round it up right now. I think we have exhausted 2 hours. Again, we thank you for coming in to present this wonderful topic. If you have any other conclusive remarks, please do so.
But with this information that you have given, I believe that it is going to go a very long way, to encourage many people to take this vaccine so that they can continue to stay healthy and alive. We have also benefited from you that we have received this information. We have to go out there and be ambassadors to spread the message to our friends, to our parents and our loved ones, which is very important to us. And most importantly, we are happy that this video is going to go to YouTube, where so many people will log onto our channel to watch it to the benefit of the whole public. So we are very, very grateful. We really thank you for honoring our invitation. I want to take part in this program. All our audience, whatever you did to make this program a success, we really appreciate you. Your contributions, your questions, they went a long way, to make this program a success. Thank you, production engineer. Thank you, director. Thank you, everyone. And we are very pleased to have you in the program today. So, dear viewers, that was Dr. Edmund. He has given us a very powerful presentation on vaccination awareness. Those who have not known about the Gaza Media channel, make sure you log on to our YouTube channel, subscribe and turn on your signal so that anytime we upload a new video, you will be the first to receive our signal. And don't forget to leave your comments so that we'll always know how we are doing. And feel free to share our videos to your friends and loved ones. Stay tuned to our subsequent programs and have a wonderful day ahead.